Okay,
Live.
we're live on YouTube now.
Thank you very much indeed, and good evening, everybody, to the Health and Adult Social Scrutiny Board. COVID-19 pandemic, virtual decision sessions of scrutiny boards are taking place. May I remind everyone present that this meeting will be broadcast live via the internet, and the record will be archived for future viewing. We are using the WebEx system, and members and officers will be communicating via the system. As set out in the agenda papers and on the website, any member of the press and public may listen to the proceedings at the virtual meeting via a web link, which has been publicised on the Council website. The participants in this meeting will be the councillors concerned and the officers presenting reports. Members of the public who have requested to ask questions are also present for that agenda item. May I remind officers and members participating that during the meeting, all participants are in control of their own microphones. You must place your microphone on mute whilst not speaking to an item. I will use my discretion as to the order in which participants speak, and I will announce whom I'm wishing to speak to, but I will try and get you in the order that I see you. The nominated speaker should then unmute their microphone and mute it after they have finished their contributions. I know you're all getting very experienced at this now anyway. May I remind members to refrain from using the chat facility. With regard to declarations, if a declaration is required after the meeting has started, this should be announced in the usual manner. And with regard to an adjournment, which is not very likely, but we'll see, if I wish to adjourn the meeting at any point, I will announce the adjournment and inform you as to how long for. All participants should remain in the WebEx meeting facility with your microphone muted. And I know colleagues recently had a very, very, very long meeting. And although ours are quite long, I think hopefully we won't need a comfort break, but we can always pop out. There will now be a roll call to confirm the members are present at this meeting. Am I doing that, Joe, or you?
If you could do it, please, Cabinet Member.
Okay, right. Councillor Case coming late, right? Councillor Howell? Just to say present. Councillor Kennedy? If you just unmute and say you're here, so everybody knows.
Present.
Thank you. Councillor Kais? You're present.
Present.
Thank you. Councillor Hodgson? Just say present.
Present.
Thank you. Councillor Sexton?
Present.
Councillor Byrne?
Present.
Thank you. Councillor Thomas?
Present.
And welcome Cabinet Member Councillor Rinsell. There are officers from Solihull Council, NHS England and NH Improvement and Birmingham and Solihull CCG. I would like to thank officers from across the organisations on behalf for their hard work during these challenging times and for finding the time to attend this meeting to support members. Our first item is apologies. Do we have any, please, Joe? Nope.
None received, Cabinet Member.
Thank you.
Sorry, Chairman.
Declaration of interest? No, I see none. Thank you. Is that right? Where are we? We've had questions and deputations. Had no requests, have we? No.
No, there's been no requests.
Thank you. Right, item 4, the minutes. Could I ask the Scrutiny Board to approve the minutes from the meeting of the 15th of June? So we start at page 5. It's the easiest way around, and just stop if you want to come in on anything. Page 6. Page 7.
If I can come in there, please.
Yes, Councillor Byrne, yes, go ahead.
Hunt. Yeah, just an amendment, please, towards the bottom of page 7. We actually made a recommendation to the staff be thanked. Oh, sorry, I think it's the wrong one. Sorry. That's the hospital name. Sorry, I think it was actually page. I'm struggling slightly here with the page. Here we go. Sorry, it's page 10. Sorry, I've leapt in too
Page-
soon. I will come
page-
back to page 10.
10, is it?
Yes, sorry, I'll
Or-
come back to you when you get to page 10.
Yeah,
Sorry.
yeah, okay. Page 7, page 8, page 9, page 10, Councillor Byrne. You're on mute. You're on mute.
There we go. Thank you. Yes, it's just a small change. At the very top of page 10, it was actually a recommendation that, on behalf of the Scrutiny Board, that the adult social care team and care providers were thanked on our behalf for their hard work, etc.
So we want to add that in, don't we?
Yes, as a recommendation. Yes, so just move the bit where it says resolved down to under recommendations. It was unanimously carried, if memory serves.
Which are on page 11. Well, they were resolved, but you want us to put the recommendation. Yes, I think you're right to say that.
It's top of page 10 I'm talking about on my, I'm looking at the digital version, which maybe sometimes the different page numbers to yours potentially.
Okay,
It's just above number 8 in the minutes.
right. Right, and you want to add in a further recommendation?
Yes, so the text under resolved and was actually a recommendation we agreed.
We did, yes. To note the report and request officers continue to review the easement. Is that where you are?
Yes, Sam. So under that to add in recommendation that on our behalf, staff in adult social care and care providers are thanked for their hard work and sacrifice in response to the challenges of COVID, etc.
Is everybody happy to put that in? Just a thank you. Just yes. Looks pretty unanimous. Okay, thank you, Councillor Byrne. So we go back to page 12. Anything else? Page 13, 14, 15. Right, and we finished at 9 o'clock. So are you happy that there's a true record now of that of that meeting? Could I have someone to say okay with it? Yes. Thank you very much, Andy, and everybody else. Okay, thank you. Right, now the dental service is running a bit late, I must say, please. So if we could move over to Cabinet Member, please, Councillor Green, so item 6. If you'd be good enough, please, to present your report for the coming year, 2020-21, we'd be very pleased. So welcome to the meeting, and if you could carry on, please. Thank you.
Thank you, Chair, and good evening, members of the board and officers that are here this evening. I can't see you all on my screen, but hello. So yeah, you all have before you my report looking at my priorities and obviously the challenges for the year 2020-21 as we move forward. Obviously, I was with you a few weeks ago, sort of finishing the last municipal year, but now we've got need to focus on the coming year and what really we're going to be facing, as you can all imagine, the ongoing COVID-19 impact and how we manage that. And as we move forward into the winter, obviously this committee will all be fully aware of winter pressures, but obviously we'll be facing those with COVID running alongside us, sort of there in the background, as we don't know what sort of future spikes in infection rates that we're likely to see. So that will really set out much of the work plan for certainly for the foreseeable future and the next few months. You'd be aware that we've just had a refresh of the health and wellbeing strategy, and we've added COVID into that strategy as a priority 5, and as set out in the report, the other 4 priorities. Health inequalities through COVID has really been highlighted, so that will be something that we will very much focusing on, and looking at the impact of COVID on certain sort of sectors of our community, people, different groups, those that have probably been disadvantaged and had the most severe impact of COVID. So we need to look at those, assess those, and see what we need to do going forward. As I've mentioned previously, I'm part of the Health and Wellbeing Board. We have prioritised the immunisations and vaccines for the coming year. As you know, as I said, with the winter pressures comes with it the flu, and we need to make sure that as many people as possible have the flu vaccine. We're also seeing lower numbers in child immunisation, so we need to again get those back up and running, you know, for our children to obviously be properly immunised and ready for school. Later, now I've put in at 3.7 later life accommodation. Now, a big focus for adult social has obviously been in the past housing and care homes. As you know, we've built care homes, but things may now change. So that's again something that we'll be looking at and reassessing what type of accommodation our residents will need in later life. So some assessment of that will be done this year. And one of the big impacts, I think, of COVID, as many of us have seen, many of us have been out in the community, social isolation has proved to be a big factor, and that has led to quite a lot of mental health problems, which we're now sort of starting to see coming to the fore. There is a task and finish group set up that is particularly looking at loneliness and social isolation, and we're working with some of our partners, Age UK, Alzheimer's, Carers Trust, other partners, to look at how we might reduce that, and some of the community groups, how they've come forward, how they might also be able to help with that. Digital, that's played a big part, as we're all seeing this evening. We're sitting here talking to each other virtually. For many members of the community, that's been a great asset and a great comfort to them, but for others, they are digitally excluded. So we are looking at how we might improve that and what opportunities are there. What else have we to talk about? Through COVID, some people have obviously got much more active. A lot of people are going out walking and cycling. So a large part of the Solihull Active programme will be reinstated. And obviously we want to develop it as well, because we're going to be improving the Solihull on the Move, a big programme this year. So hopefully that will be taken forward. But that does cross over into another portfolio. But basically, we want to get as many people continuing to exercise as they have now started. That becomes routine, that becomes people's daily lives. And those that have been isolated, that we can start encouraging them to come out or exercise at home through the active chat, which you've seen in the digital work. So there's a lot of crossover of work going on throughout the portfolio. You'll also we've put sort of information into this report that sort of gives you a little bit of a look back, but also look forward. So it shows you where we've had to pause work and where we're now starting to reinstate and start working on what looks like the new normal for us. Doing some things virtually that have started, and they will continue. And then, you know, as time goes on, that interaction, you know, face-to-face interaction will be resumed where we can and where it's right to do so. So that's just really a canter through the report. I'm happy to take any questions. I know I've got officers here also, if you'd like to ask any questions in particular. So over to you.
Very much indeed for that. Just like to ask you a bit on a question on Iris, you know, the domestic abuse. How successful can the Iris approach be in an era of GP video consultations? Is that working or not? Because they do a good job normally, don't they?
They do. I mean, that's quite a large focus of work for GPs. And I think with the actual virtual consultations now, GPs are doing far more. I think they're probably able to see people much quicker. I certainly know with talking to various GPs, you know, they are getting back to people, back to their patients, some within half an hour, some the same day, whereas potentially you might have had to wait quite some time to see your GP. We are seeing definite increases in domestic violence coming forward. But just to let you also know, you may know about MARAC, the multi-agency risk assessment conferences that come together now. They meet much more regularly now. So any of cases coming forward of domestic abuse are being picked up much quicker. So they're looking at the caseloads, and obviously at the beginning the numbers were down, but we're now seeing a gradual rise in cases coming forward. But hopefully, as more and more people are getting out, they're able to get the support they need, whether that's again through the GPs, Birmingham and Solihull Women's Aid, but obviously they're able to talk with friends, relatives, you know, just have that support around them much easier now as lockdown has been released.
Thank you very much. I've got Councillor Howell. Does anybody else signal? Kenzie, Thomas and Blunt. Councillor Howell, thank you.
Thank you, Chair, and thank you, Cabinet Member, for presenting your report. As you said, in the next municipal year, all your reports and your actions for the next municipal year will be going on with the background of COVID-19 ever present, and of course we don't know how the infection rates are going to year. There's obviously a lot that we still don't know about COVID, but there's a lot of research being done at the moment, and there are some very interesting correlations. I believe they found that a healthy weight and a generally healthy lifestyle does correlate perhaps with a better response, for want of a better word, to a COVID infection. And I was just wondering if with your healthy lifestyles strand of work, are you going to be perhaps particularly promoting that to groups that we know may be at a higher risk of COVID infection?
Yeah, I think you're absolutely right, Councillor Howell. I think there's a lot of information coming out, and we don't know everything about COVID at all. But as further reports come out, interestingly, I've just been on a call around the population intelligence hub. So there's so much data now being collected, and even just from a personal point of view, I know people who have had COVID, and they know that by having a healthy lifestyle and being healthy and active and fit help them get through it, and they know if that hadn't have been the case, they would probably not be here today. So I think as we see more information coming out, I think we'll obviously learn a lot more about the virus. But absolutely, as I've said, through the report, you can see if we can get more people to stop smoking, if we can get more people to get active. And, you know, people, you probably saw in your own communities, all of you, you know, people going out, they were told, go out for an hour, and they were walking and they were cycling, they were with their families, going, you know, they've been to the park, they've been out. It has a huge impact, you know, on your general well-being. So I think the programs we've got, and as we get them back up and running, and we can do some of that virtually, you know, you can do, as I mentioned, the active chat. That is about, we've put in a bid for some funding. It's about getting people active just in their own home, so they can do the exercises at home. They don't have to run marathons. They, you know, they just get a bit more active, and I think we'll find that will help people, especially tackling all of the health inequalities that you know yourself, if you go out for a walk, you go out for a run, you feel much better afterwards. So yeah.
Yes, thank you. Sir. Well, as I said in your report, there's a lot of cross-reference between the cabinet portfolio to do all that you're asking for. I've actually got Councillor Mackenzie next, but welcome to Councillor Bunt to the meeting. Good to see you here. So we'll have Councillor Mackenzie next, please.
Thank you, Chair. Mine's at 3.2 about immunisations.
Oh yeah.
It did concern me to think that they weren't going ahead, so I did contact my doctor's surgery to ask about how they were doing with their immunisations, and they said they were just going on as normal. The letters are sent out to the parents as normal. They just may have to go to a different clinic
Different place. Yeah.
for the immunisation. But and the thing is now about the school immunisations. So I would hope they obviously aren't going to be done at school. So will those be followed up the same? That is a really important thing to make sure that they've got their immunisations.
Yeah, that absolutely. That's what we want. Any backlog, we want to make sure we're getting up to date. And as you say, they might choose other locations to take people to, because obviously with the GP practices, you've got hot and cold sites. So they're using GP practices for different activities. So you might be directed to another GP practice, or ultimately they might just send you to another location. In terms of the winter flu vaccine, we want to get a high number through. And as you know, it can cause a lot of chaos and a lot of people descending on certain GP practices at a given time. So there are possibilities of using other sites. It's something that the CCG is working with us on, and Ruth might want to come in and answer further. But you know, we've got the facility at the moment up at the NEC where they're doing outpatient consultations. There might be other locations that we can almost get that drive-through going. So they're working on that at the moment, just to look at the numbers and see where we need to get people to.
Do you want to on this, Director? Tennant?
Yeah, so just I think that's absolutely spot on. So I think the key thing at the moment is obviously flu vaccination is going to be difficult this year because you don't want large numbers of people congregating, and that was always the way it was done in general practice. So that's where those, you know, bigger sites that can take big capacity is really important. But I think the other thing that's also really key is as and when a vaccine becomes available for COVID, and obviously there's a number of trials of that going on at the moment, they're going to want to get people vaccinated as rapidly as possible. So lots of the thinking at the moment is, let's get it absolutely spot on for flu season, then we use exactly the same machinery as and when a COVID vaccine becomes available. And I think on the childhood vaccination, I think that's absolutely right. The GPs have carried on doing these all the way through at the kind of green safe sites. I think one of the issues that we have been in contact with NHS England about is obviously some people just didn't want to go anywhere near general practice or anywhere near health facilities. There was a bit of a fear factor. So what we're trying to understand is actually how many people just stayed away, and how they get a catch-up campaign that brings through all those children's, whether it's in school or whether it's using some of the same facilities that put in place for flu. So I think what we're going to see is a huge volume of activity, and I know talking to the CCG, it's really, really high profile to get that absolutely spot on, and a huge amount of planning going on at the moment around it.
Thank you. Councillor Thomas, please.
Just wanted to pick up on later life accommodation and really ask two questions around this. So it notes that Solihull's population is older than the national average, and we're expecting this to increase. And as a result of having a high elderly population, we're obviously building facilities to support their needs. So we're putting a lot into care for the elder generation in terms of investment. But is this creating a bit of a vicious circle of drawing more people, more elderly people into Solihull, and further making this population imbalance more noticeable. And I don't really know how you break out of it if we are, but is that just something to consider? And the other question was, are the care homes within Solihull evenly distributed over across the borough, or are they noticeably concentrated in the south of the borough?
Okay. First of all, you know, we've built Chalmers and we've built Tamworth Court. That was basically to fulfil a need that we weren't actually sending people out of borough. So we needed more capacity within the system to be able to accommodate Solihull residents within the borough. So it all depends on particular need at a certain time. Not everybody will need a care home all at the same time. So it's having that flow in and out, and then being able to accommodate people in the borough. And obviously we're, you know, at affordable rates, so that we're not paying more money as we take people out of borough. The second question, which was, forgive me.
So are care homes equally distributed across the borough? Or are they more concentrated in the south?
I think Karen Murphy will tell you definitely on the geography, but I would say there's more probably in the south than there are in the north.
I think definitely. Karen, do you want to put
it? 66 in the borough.
Yes, that it is accurate. The homes, of course, develop where they can secure land and where they think there is demand and workforce. So we've little control over that, other than through the planning process to express a view on their location and whether we need whether we still need more capacity or not.
Mm-hmm. Would it be possible just to get the figures on the north-south split on the care homes?
Certainly, yes, we can give you the distribution. Yes, and
Thank you.
Got maps as well if you'd like one of those. Yeah,
that'd be great, actually. Yeah,
okay,
thank you.
We'll do that.
Where they're all dotted. Yeah.
Right, Councillor Blunt, please.
Thank you, Chair. Thank you ever so much for that, Councillor Grinsell. It's really good report. Really going to be really interesting to look at some of the proposals coming through the system over the next 12 months. I think you're right, you've picked up on all of the crucial bits that we need to be looking at. I just wanted to pick up, and apologies for slightly going back to what Councillor Mackenzie said, the immunisations and vaccinations bit is going to be really interesting. I know we've covered it at the last meeting, and the CCG were talking about their sort of early stage thoughts on how they're going to get the catch-ups in place, because this is going to be crucial, because all of us know that this winter could be particularly bad, both for unfortunately a second spike, but also for flu and things like that. So this is going to be absolutely crucial. So it's really pleasing to see that Solihull Council are working really closely with the CCG on that, and I'm sure all of us will be looking forward to seeing you know, the plans as they're developed when, you know, before they sort of get enacted. I also just wanted to touch on the points that you've made about bereavement support. Obviously a topic very close to many of our hearts, and you know, really crucial support to be put in place, and that's then followed by the suicide prevention strategy. Really saddening news to hear that suicide rates have gone up, and you know, that it's really important we get a really good system in place. I know that Solihull Council and you have worked really hard on that, and you know, hopefully you know, the more support and mental health and things like that we can put in place, the better on this issue. But it's going to be really interesting to assess the outcome of the bereavement strategy. As it says, you know, we're not quite certain yet on things, because, you know, children haven't got back to school and things like that. So that's just going to be really interesting to see, because particularly you know, the children of people who commit suicide, they are statistically far more likely to then commit suicide themselves. So if we can get the right support in place early, that's absolutely crucial. So it's going to be really interesting to look at this bereavement support being put in place, and an assessment later in the year. So I thank you for that, and you know, I look forward to seeing the results of these. But yes, thank you ever so much for your report. It's really very detailed.
Thank you. And I think I would ask councillors to, you know, when we are promoting these services, so whether when the flu vaccination comes or it's the bereavement services, you know that the council comms put this information out. Please do share it with your channels of communication, you know, through your channels of communication to residents, because the more people that know about the services, the better that will be. And just with the bereavement services, I passed on information to people while, you know, through the pandemic, and the comments back were that they were really pleased with it, and found it very helpful. They may not have been ready right then to talk and go through the whole process, but at least they made contact with somebody, and there was somebody there that they knew that they could go back to it if they needed it in the future. So thank you for that, Councillor Blunt.
Thank you very much indeed. I've got Councillor Hobson and then Councillor Sexton, please.
Thank you, Chair. I've got a couple of questions. The first one is relating to, well, it's number 3.1, the health inequalities. And I just wondered, it talks about a linked health inequality strategy. I just wondered whether that strategy will be put in place. I think it refers to it being developed. So
yes, it's in development at the moment. And as I said, through the introduction, you know, we're learning all the time, and you know, we've got to tackle some of these health inequalities. Actually, we don't want the gap growing. So, and I said, you know, any specific challenges that come out. I mean, obviously, there's been a big focus recently on the BAME community, but there will be others that will be particularly affected through this, and there might be sector work, you know, there's all sorts of implications. So as that information is coming through, we'll be putting together this strategy, but that will be, you know, in the very near future.
okay, my second point is relating to digital. I'm really pleased that we're actually putting extra resource into that area, but there's still quite a number of people out in the community that don't have access to digital services, and I just wondered if you could actually indicate what we're actually doing to try and maintain contact with those people. I'll mention something now. I'm quite interested in how the Liquid Logic application has been implemented, and I wonder that's an item probably for an update on the work programme going forward. And I'd like to see practitioners being involved in that session if that's possible. I have got another point. Sorry, there's quite a lot of detail in this report, so bear with me. I'm interested in the clean air strategy, but I'm just wondering whether it could go onto the work programme or whether that's more likely to be covered by a different you know, committee.
Yeah.
That's it from me. Thanks.
Thank you very much. And Councillor Sexton, please.
Thank you for that, Chair. As the opposition spokesperson for this portfolio, I've got a number of points I wanted to make. I don't know if you want them one at a time or in bunches. What would be most useful?
Far away.
Excellent. So, I mean, first of all, I want to say, to start by saying, actually, I'm really pleased to see some of the priorities in this report, and I'm particularly pleased with the prominence that we're giving to the issue of health inequalities, and the fact that digital exclusion seems to be being explicitly tackled. Obviously, the focus on mental health and domestic abuse and suicide prevention, these are all things that we've talked about a lot in the past year, so it's great to see those prominently on the agenda there. So now I'm going to nitpick. Going for section 3.2, where we talk about work will progress to understand any potential for change in public aspirations for care and support. I'm not entirely sure what that means. I wonder if somebody could clarify that for me.
Do you mean, are you at 3.2?
Yes, the last section of 3.2. So work will progress to understand any potential for change in public aspirations for care and support influenced by the reported experience.
Yeah. No, it's just something in general, because obviously the pandemic, there's been obviously a clear focus on adult social care and public health. Now, if you take adult social care, big focus on care homes. So we don't know right at this moment what you as an individual, if you've got a parent who's got to go, you think has got to go into a care home, do you want to keep them at home? We would have always encouraged people to remain independent and stay at home for as long as possible. That may still be true. Will people still want to go into care homes as they've done it in the past? Interestingly, people who are lonely and isolated may now start thinking, well, actually earlier, that they may want to move into extra care. So it's about thinking, what will people want in the future? It's a bit of crystal ball gazing, I suppose, to see what the future looks like. What would you want for your parents, your grandparents? What would we want when we've come that age? It's sort of trying to plan for the future and think about how COVID might have changed people's perceptions. So you want to bring the confidence back and make sure people are truly comfortable with the arrangements they're put in place for their loved ones.
Great, thank you. Moving on, we've got section 3.6, where we're talking about capitalising on potentially positive developments from the lockdown. Now, this is it's great that we do that, of course. I'm aware that that window of opportunity seems to be closing, so I'm wondering how we can act on that as quickly as possible in order to make sure that we do manage to maintain some of those benefits, especially with regard to the walking and cycling piece.
Interesting you bring that up, because there's actually a survey, isn't there, at the moment about what people think about the walking and cycling emergency measures that have been put in place. I was very much hoping that people would like to keep them, but I'm not sure whether they will. So that's some of the survey work that's going on right now.
Okay, thank you. Moving on to section 3.7. Now, and where we're focusing on later life accommodation. In the previous year's priorities, we were talking more generally about support options for older people. So I was wondering whether there's a particular reason for the shift in focus, and also where it says that we're going to review local preferences in order to influence strategic planning and the market offer. I'm wondering how we're going to influence the market offer in particular with regard to obviously care homes being private entities.
Yeah, and it's a bit about what I said earlier about having the confidence for people to go to place their loved ones in care homes. So we will continue the support to our care homes, and obviously we've done that throughout the pandemic around the PPE requirements, training. We'd had a conference before COVID started, and then we'd got that real engagement with care providers, care homes. That's been ongoing. Obviously, I think Karen will tell you whether there's still daily contact with the care homes. Literally, it had been on a daily basis. Care homes know that they can contact us. So I think we'd have a good signs to know what's going on in the care homes as we move forward. Yes, they are private businesses, a fair number of them. So it will be, for some of them, it will be a business decision around their futures, but hopefully they will still be here, and they will still be here for a long time.
I know when we've discussed this previously on this board, I think the Assistant Director expressed some concern around potential, let me see if I've got this right, potential oversupply of care home provision and the challenges that might pose us with regard to staffing. I don't know if that's still the case.
I think staffing will always be,
yes.
I think staffing will always be an issue, won't it, where there's demand for staff, and I think we spoke about it at the last meeting. You know, people have been working extremely hard in this care sector, and whether they will continue, we need to be able to encourage more people to come into the sector. So that will certainly be an ongoing challenge. There will be demands from other local authorities, areas where people may choose to go and work there, but hopefully Solihull's a good place to come and work, and we would just encourage them to come. So, you know, there'll be obviously talk with our colleges, with our care homes to see what's needed going forward.
Great, thank you. And we pick up some specifics later when we talk about the care home piece.
Yeah, you will. Yeah.
When we're talking about digital in 3.11, and it's really good to see that the question of digital exclusion is being addressed. We mentioned there's going to be this review of the use of digital channels across key services. I'm wondering if when that review is expected and whether that will be coming to a future meeting of this board.
How do I answer that? Well, we've actually got a digital task and finish group, so it brings together different areas of the council. So whether that's people from communities, whether it's communications, so it's just really what else we can do in terms of our digital facilities across, you know, other areas, so other areas of the council. So what else can we put onto digital where possible makes life a little bit easier. So that's will be a review across the council. And also I think Councillor Hodgson asked about the liquid logic. The liquid logic has been installed for children's and adults, but they're I think the whole computer system, the whole system for the whole council is currently being looked at.
That's great. I'm really interested. I'm really interested specifically in this piece about how the public are responding to communication via different channels and what material resonates best. So I'd really be interested to see that once it's available, if we can have that circulated and hopefully a future meeting.
Yeah, there'll be some people that literally, you know, don't have a phone, don't have a mobile phone. But, you know, there's also the question around the cost for people becoming digitally active. So those that are currently excluded, what is the cost to them? Because it's not just simply about having a phone or a tablet and being able to use it. It's about everything else. You've got to have your internet connection and everything. You know, what is the the overall cost and the ongoing cost to people? But I know we have library facilities when we can go into them. There are places that you can go to use computers. But we're not quite at that point yet where everything's back to normal, because it's not. So it's just thinking all of this through about people of certain age, certain groups that may not be able to get online and become digitally active.
Fantastic. I look forward to seeing more about that.
Yeah, I think that is going to be a big. I think literally that's a big piece of work for not just the council. It's everybody's daily life, isn't it? You know, business out there that are getting, you know, their staff are all working from home. We're all just having to work in a new way. But it's getting as many people using digital platforms that want to. You don't have to, but we make sure they're not excluded from it.
Great, thank you. Moving on to the mental health and the suicide prevention, I'd like to thank Councillor Blunt for her comments there. As some of you know, this is a topic that's particularly close to my heart. The figures around the number of people bereaved by suicide, I'd really like to see that data. I wonder if we can get that circulated so we can look at where that issue is. And with regard to the mental health services and the review of ensuring that these channels are all connecting up, I know that there's still some work to do there. I've been in touch with the Mental Health Foundation Trust around some of that. So it would be good to get an update once that's been done.
We're just doing that mapping work now to see where we are with everything and what provision is out there.
Fantastic.
We absolutely want to see where the gaps are.
Great.
Not just about saying yes, there's something for everyone. We need to know if there are any gaps. So by doing that mapping work, we should be able to tell.
Fantastic. And if we can maybe get something circulated on that once it's been done, that would be
done. It'll be brought back to
great. The domestic abuse piece, again, I'm aware of the additional challenges that we've faced during the COVID crisis and with the lockdown, and tragically there's been some really heartbreaking stories that have come out nationally around this. I've been following the progress of the domestic abuse bill in Parliament, and I know that there was a lot of talk about the challenges faced by migrants in particular, and those who may have no recourse to public funds. Do we do any work around these issues in Solihull? And have we given any thought to that?
Whether it's directly in relation to domestic abuse, but I know the numbers with no recourse to public funds are very small. So in single figures, small. So, but then they may not be related to domestic abuse.
Okay, that's great. I know there are some additional challenges faced by particular communities with this, and my colleague Shaheen Ashraf, Councillor Ashraf, has been. I know she's been involved in some work on this, so it would be good to obviously look at that in the round as well.
And as the bill goes through, then there'll be more work done. There might be more work actually done through the Safer Solihull Partnership as well. So that's where there's a crossover in boards.
Great, that's good to hear. A quick point on the air quality monitoring. It says that those have been paused for 3 months from March. Are they now? Is that monitoring now?
They're just back up and running.
Right.
It's basically just because of the, where the diffusion tubes are sent off to the lab. The labs were all dealing with COVID, so everything else was put on hold. So we're now just back up and running with, and obviously with the schools back, being able to have the capacity to do the monitoring as well. It's a bit more difficult on individual properties if it's their, houses or that sort of monitoring. But it's slowly getting back. It may not be fully because it would just depend on the capacity within schools.
Great. Okay, that's great. And one final question: the work being done by Solihull Active. This looks great. Do we have any demographic data about the groups that are being engaged by Solihull Active, and whether there are any gaps in who they're working with?
Yeah, I think they're working with all groups, but in terms of the pilot, we've got 4 groups that we were particularly targeting. But actually, I think some of that work now, especially through Sport England, is more about getting all people active. So the remit has actually been extended a little bit, and we're just refocusing some of that work with Sport England. So we've had a meeting a couple of weeks ago, and actually they're more open to just generally more people getting involved in sport, as they've seen, because they're learning as well. You know, Sport England, they're learning about people's physical activity. But I think within the groups there will certainly be the monitoring and the recording of who's been involved in the activities and what age groups.
That's great to hear. Again, that's something that I'd be interested to see, just to make sure that in terms of the people who've been engaged during the COVID crisis, we're not missing out on any groups in particular, with particular regard to, for example, minority communities and so that, just making sure that that's actually happening in practice as well as in intention.
Yeah, and then, well, that can be something as well, part of the work programme, to bring that
Right.
that whole piece of work back. Yeah,
that's fantastic. Thank you very much. I know I've asked for a lot of detail there, and I just want to say again that I'm very pleased to see the direction that we're going in, and thank you for your patience with my questions.
No, that's fine. And I think really, as I've said, you know, this is a snippet of what gets done between the two portfolios. Really, there is a huge amount of work that goes on, and you know, you could have put tons more into this, you know, drug and alcohol services, all sorts of things. So yeah, this really is main focus, but there will be sort of reinstating so much of the other work where we can do that, and obviously we've just got to monitor how it goes. So I just want to acknowledge all of the officers that are here on the call on this virtual meeting now. I mean, the officers, as I say, in adult social care and public health have just been phenomenal. They have just worked hard. So I just want to extend again my sincere thanks to everybody who is behind this portfolio. Or two portfolios. It is huge, and they've all worked extremely hard, and will continue to do, I know.
I'm sure I'd like to echo.
I can't see their faces. Let me.
Thank you.
Yeah, they've certainly worked very hard indeed, Cabinet Member. And I think swimming pools are open now, aren't they? An awful lot of older people like those. There's a lot of people. There's been a lot of people out doing that sort of sport. Colleagues, I think I haven't any further questions from you. We're asked to note the Cabinet Member's priorities for 2021. Does the board agree with these recommendations? And any further comments? I think Joe's got most of it down. So you're happy?
Chairman, am I right just to read a couple of things out that were potential recommendations for the discussions? So Councillor Thomas asked for to provide information on care homes within the borough. Can I just check with Karen whether that would be all right, please?
Yep, I've asked for that to be done already, and we'll send that to you as soon as we can.
Well, thank you. And then Councillor Sexton asked for a report in relation to digital channels across key services. And in November on the work plan, we've got digital and technology use in social care and healthcare. So if that can be wait until then, would that be all right, Councillor Sexton?
Sensible.
Well, and then the last one was also from Councillor Sexton, and to receive data on activity from the bereavement services. Did I capture that right, Councillor Sexton?
Not quite. It was the data around the bereavement by suicide in particular. The report mentions that those have increased, and I'd be interested to see more detailed data around that, and also the mapping work that's going on with the mental health services at the moment to identify where the gaps are. Once that's been done, I would like to see a report on that.
Can I just say, I'm not sure if this is a bit sensitive, Mrs. Murphy, or do you think you could give something to Councillor Sexton anyway? Because I heard what you said. It's quite an important one. Where's Mrs. Murphy gone? Karen? Are you happy to do that?
Sorry, could you clarify what you're asking?
Rosie,
It was I don't necessarily need it now, but it was the data around the number of people bereaved by suicide. The fact that that's increased is obviously a bit of a worry, and I'd quite like to see the original data on that as to, you know, where that's coming from. So if that could be sent around, as I say, we don't need to discuss it right now, but I'd like to see that.
Okay, I'll do it. I think public health colleagues may have access to that kind of data, but we'll do everything we can to find the available data of those bereaved by suicide for you. Yeah.
Thank you.
Thanks very much. I interrupted because I thought it might be a bit difficult. It's not an easy one to answer. Right, are we okay then that we move on? Thank you very much indeed, Cabinet Member. Very detailed, and you have an enormous portfolio. I don't know how you get through it all. Right, folks, could we move back now, please, to the dental services, which in fact many of us asked for at our last meeting. We're going to have an update, and I'm very pleased indeed to welcome representatives from the NHS England and NHS Improvement, Midlands, Noella Woodman, I think she's here, isn't she, the Deputy Head of Primary Care, the Commissioner and Tracy Harvey, and Senior Commissioner Manager, and I think we've got Penny Heatherworth, is here? Yes,
I'm on the phone.
Clinical Lead from the England Foundation.
Yes, I'm on the phone.
Thank you. So who's going to start off with this?
Would you like me to start? Can you hear me?
Thank
yes.
you. Yes, please.
Right. So thank you for inviting us to come along. I brought Tracy, who's the Senior Commissioning Manager for the area, along, and Penny, because Penny's been very involved with the urgent dental care system that we've had in place during the lockdown in case there were questions that needed to be answered. I did put out a presentation and a briefing paper. The briefing paper was one that we did generically for the Birmingham and Solihull, but I did share some more detailed information about Solihull in the presentation, and I've got some updated information as well, because we're still liaising with our practices about their state of readiness for services. So I think people are very aware that dental services were severely restricted during the lockdown, and I'm not sure everybody completely understands some of the issues, because a lot of what is routine dental is in the aerosol generating procedure category, which is some of the most dangerous procedures. So in order to run services, we've had to have very stringent operating procedures in place to ensure the safety of staff and of patients. So we had urgent dental centres running. We put 88 in place across the Midlands. There were 2 in the Solihull area, plus we had a hot site, which was for COVID positive patients or people who were associated in households. That site has been very little used, actually. Initially, we were having to send Solihull patients to Birmingham because the activity is so low. But we were lucky that I think it proved the catalyst to finally getting the Smithswood Centre, which is a new facility, open, because it's ideal for doing aerosol generating procedures. Penny, did you want to come in? Because it's really good news that Smithswood's open, isn't it? It is. In fact, last Friday we met up with the two of the councillors from for the Smithswood area, came to have a look round the new facility. So it's special care orientated going forward, because it's part of for our special needs patients, but it will allow us to see bariatric patients up to the weight of 31 stone, provide sedation services in the north of the borough, as well as our routine special care work that we undertake anyway. So it will certainly make it's a lot better environment than the current clinics that we've got up there. So it's a great thing going forward.
So that's good news, because we've been, it's been a long time in gestation, that facility, and it will replace some rather outdated facilities. So it will bring things. We'll have much more modern facilities going forward for the service. So we have had the urgent dental centres running. I know that people were very frustrated, but
access to dental services was very restricted because of the dangers involved, so that we were operating to national protocols. All of our practices continued to operate and run what we call AAA services. It's advice, analgesia and antibiotics. The idea being to try and manage patients remotely where they could be managed remotely, but the urgent dental centres were in place where patients needed to be seen face to face, and we had a dedicated site for vulnerable patients so that we could segregate the different groups. So we had a hot site for patients who might be positive, we had a asymptomatic site, and then we had a vulnerable site which was for the people who were in those vulnerable categories, the elderly or the ones needing flu jabs, so that we would keep the different groups segregated to minimise risk. And there were very complex procedures in place to ensure safety. As obviously there was an announcement which took everyone a little bit by surprise. We were hoping to reopen services, but I think that the message that we would be going back to routine care did surprise some of us, because actually I think it has caused some confusion, because there is no way at the moment that our dental services are back to normal. The capacity is severely restricted. We have got practices opening. They are going through quite a stringent process doing risk assessments on their staff, because dental nurses and dentists are at the top of the professions most vulnerable because of the nature of the procedures that they do. So we have to ensure their safety, but also of the patients. When dentists do some of the more routine procedures, you know, scales and polish, things like that, there has to be, the facilities have to be left to stand for an hour before cleaning between patients. So you can, I think you can all imagine the impact that's had on capacity for practices in terms of seeing patients. And also, I'm sure everybody will be aware that there's probably a backlog of people with dental needs who didn't manage to get seen during lockdown. So at the moment, practices are focusing very much on urgent care for the people who need urgent care. There's very little routine care going on. Similarly, we have very restricted access to secondary care services at the moment, because obviously all the hospitals are working towards recovery and restoration, but access to theatres and clinical space is quite restricted, and not unreasonably they're prioritising things like cancer services. So, but the good news is, I mean, we've been chasing around our practices to see what the state of play is, because they were told to resume services in a phased manner once they'd done all the necessary risk assessments. We have 25 practices in Solihull, including 2 orthodontic practices. And I think as of this morning, we've managed to contact all of them to get their detailed plans. We've got 16 that are up and running currently. We've got a further 4 that will go live in the next couple of weeks. And then we've got another 4 scheduling August and a couple that are going later. And we're currently contacting them to find out what the barriers are. So it should be explained that practices can get back to some level of normality. Only about a third of them are in a position to offer a full range of services, because they need enhanced personal protective equipment, special masks. They have to be fit tested for those masks. And it's been a challenge ensuring supplies even to our urgent dental centres through the pandemic. We're very grateful because the local resilience forums have supported us, because we've actually had dedicated people supplying our urgent dental centres. If I tell you we've got 88 urgent dental centres, but we've actually got more like nearly 1,200 practices across the Midlands. So scaling up the support is a massive job. The situation around PPE has improved. So most practices can open to do simple procedures like extractions, but a lot of the services that they would normally offer, root canal treatments, things like that, cannot be done without this enhanced PPE and the training and the fit testing for use of the masks. So we're and actually accessing that, because of the numbers of people trying to do it, is quite difficult. We're doing a whole bit of work at the moment to get some fit testers trained up locally to help to accelerate that process. So we're hoping that the dates that have been given to us by practices may be brought forward as we can start to support them in that. So it's not a great picture with dental services, I'm afraid, but I do think it is credit. I do want to say that we have worked really well with the local dental committee and with the community services and the acute services as well, actually, as a system, to try and ensure that we've kept services going during the lockdown period, and we are continuing to maintain our urgent dental centres. The amount of work they're doing has dropped off. They are having to juggle doing that with seeing their own patients as well. And I should point out that some of the practices that are a bit slower opening fully is because they are the ones that are engaged in actually supporting the wider system. We did review. Ideally, we would have put an additional site in Solihull itself. We struggled with that. Tracy, you might want to come in. We had quite a lot of effort trying to find a suitable site, didn't we?
What we did with public health was agree some criteria for the urgent dental centre. So there were certain conditions that providers needed to meet, and one of them was about being on a ground floor, because we wanted relatively simple access for people. So there is a site actually in the town centre, but it is upstairs without a lift. So unfortunately, we couldn't go ahead with that one. However, the other sites that we picked for the vulnerable people and for the cold site is the language, they did have either lifts or ground floor facilities and met all of the requirements that we asked for.
So we were in the process of trying to find an additional site, but then obviously practices have opened. We keep the usage of the sites under review, and actually we have a reserve list of sites, and we would have been in the process of opening up more sites, but obviously the demand has gone down now. We are continuing to keep those sites there to support. So some patients may not be able to receive a full range of services from their normal practice, and may have to go for an onward referral for some of these procedures at these sites that are set up to do this. They will continue to be in place while we're fully establishing services, and they will remain in place in case we have any local lockdowns or a second wave later in the year, because we want to make sure we've got the services in place, because it took quite a while to get them set up.
I think it's
so
important.
I don't know if you... Yeah, sorry, Tracy.
No, I was just going to say it's important to say that the centres are volunteers, and in Solihull they're both committed to continue for the long term, really, for as long as we need them, which I think is really positive. So there's no additional payments or special allowances for the practices. It is very much a goodwill system, which is, and I think Penny would agree, they've worked very much as a system.
Yeah,
it has. Yeah, everybody has been working together. So,
and it's worth mentioning that the community service, Penny was involved. The access to the centres was through a referral hub, and Penny's service have overseen that in terms of making sure that the referrals are assessed and sent to the most appropriate centre. And Penny, apart from running the hot site, you've continued to provide urgent services to the most vulnerable groups of patients, haven't you?
Yes, we have. It's included some domiciliary care as well for those particularly either shielded patients, because we've also continued to see our own urgent care patients because of their needs, which could affect them from a general health, keeping them out of hospital and things like that, or from a behavioural perspective for the learning disability type patients who, if they're in pain, then that can affect their behaviour and all the impact that can have. So we've been allowed to continue for our own patients, but from a hub perspective, it has been really useful working with the urgent care sites and everybody working together. So that's been a real positive effect of the whole thing. But at least the numbers are now starting to reduce from the numbers we were seeing.
So, I mean, the only other thing I would like to say, and then obviously if people have got questions, obviously we're very focused now on restoration and recovery. I've talked about the general dental practices, orthodontic practices are trying to get back to work as well. They have been focusing on supporting patients who are in care, and I think it will be a little while before they're in a position to take on new cases at the moment. Also, the secondary care services, as I've described, we do have some restrictions. So we have very restricted access to routine things like minor oral surgery, and also we've got restricted access for some of the children who would have been accessing services under GA. We are lucky that we've got a dedicated dental theatre at the dental hospital, but that's about the only ring-fenced provision we've got. Other than that, we're competing with other services. So we are looking actively at the moment about how we manage this, because we acknowledge people will not be getting the treatment that they need as quickly as they should, and it's how we manage those and support them in the interim and think about other ways of doing it. So we're actually missing at the moment. There's a managed clinical network running at the minute, which we'll be hopefully joining in a minute for the paediatric services. So we're working with all the clinicians to try and think creatively about how we can help to keep the system going and help to manage patients in the interim, bearing in mind the constraints we've got around the capacity issues and the throughput of patients.
Well, thank you very much indeed. Very detailed, and I'm sure members will have possibly quite obvious questions, although you've answered, I think, an awful lot of what we were pleased to hear you say, albeit there's an awful lot of areas that you're still not able to provide. And as I said last time at our meeting, we've all been by our residents worried about dental services. You know, lots of people who haven't been able to have their routine checkups and so on, and it looks it's going to be 12 months or longer, I think, before they do. We'll just have to see. Members, do you want to come in? Okay, Wasma, Keyes and Sexton, I've got you. Thank you. Wasma, Councillor Keyes. Thank you.
Thank you, Chair. My question is on the urgent dental treatment centres. If there is a patient who has difficulty in travelling safely to the urgent dental care treatment, what arrangements are in place for those patients?
We have limited domiciliary provision, but to be realistic, there is quite. One of the things about dental services is that there is a limited set of things you can do normally at a patient's home or place of residence, and in times of pandemic, when we've got enhanced restrictions and aerosol generating procedures and things like that, it is quite limited as to what can actually be done. Penny, did you want to come in on that?
Right. I mean, certainly we wouldn't be looking at taking a tooth out in someone's home unless it was extremely loose, but we've certainly been providing domiciliaries. I've been out on a number of domiciliaries in different sites across the borough, and so yes, it is possible, but we try and avoid doing anything too heroic. We wouldn't go out to do things, so it's all risk assessed to look at what we actually would do to get someone out of pain.
It's really dangerous because it's aerosol generated.
So does that help?
Yeah. Is that all right, Councillor Keyes? But somebody put in then. Sorry, I couldn't quite hear it, but still. Right, where are we up to then? I've got as colleague Councillor Sexton and Councillor Thomas after that. Please.
Thank you, Chair. So, first of all, I fully understand this has been an exceptionally difficult period for dental services in general, and I appreciate the challenges with any services at all during the pandemic. What strikes me looking at this report is that this is all, we're talking about temporary provision at the moment and how things are right now. In light of the fact that COVID is likely to be with us for some considerable time, certainly into next year, if not beyond, what do we think that the long-term solution for these services is going to look like? What's the new normal going to be for dental services, and how are we going to be able to get back to something resembling a normal service?
That's a very difficult question to answer, and I think the honest answer at the moment is we don't know. They are undertaking a review at the moment of the evidence because, as you'll understand, I think we will move into a new normal. The use of this enhanced PPE will probably be with us. There have been step changes in dental over the years, well, like when HIV and bloodborne viruses, people became aware of it, and it does have quite a big impact. I think the biggest thing hampering us at the moment, apart from just the general environment, in the secondary care and every other services, is this restriction for aerosol generating, because dental is so much aerosol generating, even, quite simple procedures. At the moment, it's this downtime that is a real problem. They are doing a review of the evidence at the moment, if they, because obviously they are quite cautious, and if those times change because there's good evidence that it's safe to leave it for less of a time, then that will vastly increase our throughput. But to be quite honest, I do think this. There are things we've started to look at. Pilots for digital. I mean, there was discussion earlier on the meeting about use of digital methods. Obviously, it's quite limited for what you can do for dental, but I think some of the community services have been using it for assessments and things like that. And orthodontists have been making quite creative use in lockdown of digital technologies. So I think services will adapt. I do think it might drive us away. In the past, it's been quite difficult to get people away from, we've always wanted the focus to be on the vulnerable people who need the more frequent checkups, whereas people tend to think they have to go to the dentist every 6 months, whereas actually that isn't the case for a large proportion of people, and perhaps the way that the contract is set up drives that kind of thing. So maybe this is I'm trying to think positively. Maybe it will help us to move to different ways of working, to actually focus on prevention, because that can be done digitally, and to actually target our services more appropriately to the most vulnerable groups who need it, rather than wasting time on perhaps more frequent checkups than are needed on some of the worried well. So I think that there will have to be a bit of a change, but it's very difficult to know, because the whole model of the way that dentistry runs at the moment is activity-based. That's obviously been abandoned for the time being, but to go back to new, I think it will accelerate. There's been dental contract reform on the cards for some time, and looking at people, because dentists do not have registered patients. People think they do, but they don't. And actually, there has been a drive to maybe going back to that more holistic approach of looking after a cohort of patients. So perhaps this will drive some of those changes. I'm trying to be positive and optimistic. It does look very challenging at the moment, but I think, you've got to approach these things and think about how you can get good out of situations and try and improve them going forward.
Great, thank you for that very, very comprehensive answer. Thank you.
Okay.
Councillor Thomas, please.
So at the height of the COVID-19 pandemic, my husband was actually on 3 occasions refused dental treatment, and as a direct refusal of that dental treatment, he was actually admitted to Heartlands Hospital for treatment, and it was only then did he receive the dental care that he needed. And I suppose the question for that really is, how do we ensure, I'm sure he probably wasn't alone in that situation, whilst possibly more extreme than most examples, how do we ensure in this current situation that people aren't just being turned away repeatedly when they actually really, really need the care?
I mean, I may come to Penny in a minute because she's been managing the hub, but I would point out that we did have problems initially because there was a period where we had absolutely no access to care except through because it took us a week or so to get these centres up and running, and people were relying very much on this remote triage. I think as we got the centres up and running, the situation improved. It is difficult, and I think, Penny, it's probably safe to say that perhaps the criteria for taking it literally about avoiding treatment where possible I think we have got better at that as things have gone along, and as have we had the capacity. Would you say? Because I think perhaps people were having repeated courses of antibiotics earlier on, and I think that that is not as it should have been. But we really didn't have any other alternatives at the time. Was the problem? I mean, Penny, do you want to come in, because you see the stuff at the hub, but it is about what you have in front of you when it comes in to be looked at and assigned, isn't it?
Yeah, I mean, some of the people did have difficulties in trying to get hold of some of their own practices, which was an issue, and NHS 111 have been very helpful, and then that has also improved because they have been referring patients who come to them who don't have a dentist, and then so we actually get information to contact rather than people phoning around everywhere. So that has improved as well. The patients that again, the standard of referring in from practices has also improved, and it also helps once people were able to actually see somebody face to face and take an X-ray, because not having digital, as Nuala said, is useful in some ways, but it's not hugely helpful. Apart from when somebody would say that they've got a large swelling and you can actually see they have, rather than when you do actually see them, they haven't, and it's just their way of getting you through the door because they say that. So it's some people knew the words to use to actually get further forward than others who didn't make a fuss, I suppose. But the referrals overall have now improved. So I would hope going forward, people know what to ask. The referral form is very comprehensive, so that would all be ready for any further waves that we might get.
And we did put an intervention in with at the start with 111, because we had a problem that actually A&E, people were going to A&E and A&E was not doing anything for dental. They were being sent away, which was not great. So we actually did do an intervention where we tried to redirect. So the 111 service were picking up that where no dental cases were going to A&E unless they became a medical case, if you see what I mean, where they needed an intervention because they had tipped over into being a medical case, uncontrolled bleeding, life swelling and what have you, and those got routed straight into that. So we did work on the pathways early on to try and improve it, to try and get people to the right places. We did have a problem early on with a few practices who were difficult to get hold of. As I say, we tried to get messaging out to the public about that 111 was an alternative route in. But obviously in the early times it was quite difficult to get through 111 because there were pressure on it from the COVID side of things. Do you know what I mean? So I think that put some people off as well, which was difficult. But I do think it has improved now.
Yeah, absolutely.
I haven't got Councillor Howell, carry on. Sorry, I hadn't seen you come.
That's all right. Thank you, Chair. Nuala, if I could just delve into a little bit more detail about something you said in response to Councillor Sexton's question. As you said, it does sound like you've got some challenging months ahead, and it will be some time before your services are anything like back to normal. And I think you did say may well lead to actually a re-evaluation of the model of this country, which, as you said, actually for some cohorts of patients may be appropriate. But what I'm really worried about is children, particularly children in deprived communities, because that these children are not going to get access to the oral hygiene advice that we know can make such a difference to their long-term health outcomes. So I was just wondering whether you do have any sort of education programme that you'd be planning to roll out to actually provide children and their parents or carers with appropriate lifestyle advice to try and encourage some healthy oral hygiene habits if they can't get access to their regular checkups.
Yeah, that is a really good point. And yes, it is one of the things that we were particularly worried about. I mean, one of the things that we noted in the regular calls that we had was that the number of children coming forward for treatment was vastly reduced. I think it was because parents were nervous about accessing services, and it wasn't just dental, it was across the board for all medical services too. And that was a worry to us because of, you know, there was obviously the safeguarding side of things as well. Before we went into lockdown, we were doing quite a lot of work on this area, reviewing all our GA pathways, trying to get a more cohesive approach, much more prevention focused, strengthening up sedation, trying to intervene early. We put a lot of investment in, and it's a shame that lockdown came. I've just been signing off payments to practices because we did incentivise them to take on under twos. So we had this whole Starting Well initiative because it is about getting those children and getting that advice in really early before they've even got teeth in. So we've been doing a lot of work on that. And there's, I mean, as I say, there's a meeting going on as we speak, looking at exactly this. I've challenged them to say, come back to me with, you know, what your suggestions are, because we really are going to have to step up on the prevention side, I think, because we are going to have restricted services for some time to come, and but that, unfortunately, that doesn't help the children who are already in that position. Do you know what I mean? We can stem the flow, but we need to. We still have to deal with the ones who've already got the problem. So it is going to be challenging. But you're absolutely right. We were very focused on the whole prevention side. One of the PHE registrars has been working with a whole group of clinicians to look at getting resources that can be used in the different services to help with this. So we're doing quite a lot of work on that. We were before, and we'll now be stepping that back up again as we go back into business as usual.
Can I also come in at that point? We do work with the Public Health Department and looking at wider measures across the whole communities, particularly with the support for health visitors and school nursing services. We've, during the lockdown, it's given time for some of my other staff to be linking back up with the public health team. And so there is work planned, again, how to get to people in different ways than we would have done before. So there's some ongoing links with the Public Health Department at the Council. So watch this space, I think, if that helps.
That's really
We're
good.
always keen to work collaboratively because it is about having a joined up approach to this, I think.
Very much so, yeah.
Are there any more speakers? Don't think so. Mrs. Woodman and the team that came with you, Tracy and co, it's been quite difficult for you, I think, because we probably would like you to tell us a lot more than we already know, in as much as there are a lot of basics in dentistry that our community are screaming out for, and I think we're still going to have to scream. But in the meantime, obviously, I think we've taken some comfort from the amount of urgent stuff that's needed, and I think we have to hope that it just gets better and better. Colleagues, you have been asked to sort of take note of what has been said. Are you happy that we take the steps, the Scrutiny Board noticed the steps taken by NHS England and NHS Improvement during the COVID-19 crisis to maximise dentistry capabilities in a safe environment? And is the board happy to agree these recommendations? Yes, you're okay with that? Thank you very much indeed, and thank you very much, Mr. Woodford. We put you on.
Thank you.
Thank you.
Thank you very much.
Thanks very much.
As I said at the beginning, we asked for this urgently last time. Right, now Joe, where are we? Item 7, I think. Right. Moving on to thing. Is that right? I've lost him. Joe, are you there? Yes. So we can move forward to the testing, tracking, and contact tracing. Very pleased, of course, to invite our Director, Health Lieutenant, and I think Sangeeta's here, is she? And if you'd like to carry on, Director, and give a brief report on this.
Yes, thank you, Chair. So I think I know I've briefed a number of you in some of the sort of the informal sessions we've been doing around the progress in terms of developing our local outbreak management plans. This is a really important part of the whole of the national test and trace system, which is very much around how do we contain the virus, and where we do get kind of cases or outbreaks coming through, how do we make sure that we're on top of those? So the report really just takes you through what the local outbreak management plans are in there intended to do, and some of the sort of key areas of activity that are sitting within that. So just by way of a sort of bit of an update on COVID, so we've had, I think it's now 899 cases right since the start of COVID, 274 deaths across the borough. Our rates in Solihull are slightly lower than the West Midlands average and slightly lower than the England average, so they're about 416 per 100,000 population. So we've definitely seen a kind of plateauing of cases nationally and locally, but what we are seeing around the region is a number of outbreaks, and I think what we've seen over the last couple of weeks is very different types of outbreaks. So obviously Hereford had a large one over the weekend on a farm. We've seen outbreaks in meat processing factories in other parts of the West Midlands, and we've obviously seen Leicester with a kind of large community outbreak. And the other thing we have seen a little bit nationally is outbreaks that are associated with hospitals, because obviously that's quite a high risk setting as well. So the aim of the outbreak control plans is to really say, well, what is it that we can do to prevent COVID spreading in the first place? So that is about how we make sure that as businesses open, they do so safely, that we're providing advice, support and guidance to schools, care homes, or even increasingly with the council facilities opening up, things like leisure centres, that's done in a way that really reduces the risk of COVID and keeps those places as safe as possible. So a lot of energy and time going into making sure that advice and information is going out to the right people. We do have, for the local outbreak control plan, we've got a health protection board, which includes the NHS, so the hospital are represented on there, the CCG, people from right across the council. So that meets weekly, and that's really making sure that all our plans are in place, and that where we do need to respond, so if we're getting cases or we're getting any signs of, an increase in cases, we're able to take action really promptly on that as well. The other thing that we do have in place is a subgroup of the Health and Wellbeing Board, which is a cross-party subgroup with me and Nick Page, and that again is meeting every 2 weeks just to check up on progress, to look at what the data is doing in quite a lot of detail, to work out where we might have any issues and look at the sort of responses that are being put in place. So that's been meeting every 2 weeks as well. So in terms of the kind of key priority areas for the local outbreak management plan, so one of the key areas is around data and surveillance. So we're now getting daily information through on the number of positive cases. We get daily information on the number of people who are being tested for COVID in the borough. We get daily reports on any outbreaks or incidents that we've got in the borough as well. So really, really important. A lot of work going on to make sure that we're really on top of what the numbers are saying, and if we do get any cases in the borough, that we know exactly what the position is on that. And what we are doing is producing a dashboard which will go out twice weekly publicly, so there'll be information in the public domain about that as well. So obviously that transparency is really, really important for this work. The other thing we are working on very intensively is testing. So obviously we've got a mobile testing unit at the Rico Arena, but we're working really closely with NHS colleagues to make sure that we've got other sites identified around the borough, so that if we did need to increase the number of people going for testing, we can get those sites mobilised very, very quickly. So that's all being worked through at the moment. I think we're doing quite well in the borough for testing. So we've got one of the highest testing numbers in the region. So I think that's good news that the message is getting out that if you have got symptoms, go and get tested. And what we're also seeing is the percentage of people testing positive is staying pretty much at the kind of national and regional levels. So it's about 1% of people who are going forward for testing who are testing positive. And that's quite an important indicator for us of what's going on with that. We're also continuing, and we'll touch on this in the next report, to make sure that care home testing is available. So that's been in place for quite a long time now. So making sure that that testing is going in there rapidly if there are any issues. So we've done quite a lot of whole care home testing, but also now with the new national guidance, making sure that that is happening very routinely. We've been working really closely with the testing team at UHB to do that, and they've also been helping where we've needed to do things like going and do the odd test in schools. They've been doing some of that work as well. I think one of the key things for all of this, and there's learning coming out of some of the sites that have had outbreaks, is we can't do enough in the way of communication with the public and really getting the message through. So we're working at the moment on the local community champions programme, and that's very much about making sure that we work with voluntary sector partners or local groups so that there are people who've got access to very up-to-date information about COVID, who can spread the word about social distancing, but I think also really importantly can act as our eyes and ears on the ground, because what we really need to know is if there are places where social distancing isn't working very well, or we need to go and do some more targeted work, that we hear about that. So that's going to be really, really important. I'm hoping that people have noticed we're putting an awful lot out on social media, so really making sure that the national campaign messages are going out on social media, and I think we put out some information for members to show people how they could forward that information and share that information. So again, we really need as much help as we can get with some of those communications messages, and making sure that as we get changes coming through, like the announcement about face masks, that we know that's really high profile and people understand that and know what to do. The other thing we're doing is working quite intensely with people like Solihull College, so getting really targeted communications out to them for their website, and that they can share with students when the college opens in September, and also picking up on any specific issues. So for example, making sure we've been working with Solihull Advocacy over testing for people with learning disabilities, again making sure that information is available and can be shared. So really pushing it out as far and fast as we can do. The other thing that's important for the local outbreak plans, and again, not something we've had to do locally, but other areas have, is really look at what are those enforcement measures that we can take if we need to. And obviously, some parts of the country, particularly Leicester, but also we've seen in Blackburn, are having to take kind of stronger steps. So either to reinforce changes in social distancing, or in some cases to introduce new restrictions at a local level. So we have been picking up where the public report things like pubs that aren't complying with some of that guidance. We have been picking that up and following some of that up. And again, we really need sort of public eyes and ears to tell us where there are issues so that we can go in early, so that we don't have to take any of those kind of bigger steps that are being used in some places. So I think that's a sort of very quick canter through the local outbreak management plans. At the moment, I think we've seen very, very small local outbreaks. So we've seen the odd outbreak in care homes over the course of it. We've seen the odd case in schools, but it's all at a very low level. So I think at the moment it's very much about getting those preventative messages out as fast as we can, but also making sure that we're really on our toes, so that if we do see any changes in the borough, we spot those really early and can take the right actions when we need to. So that's a bit of a headline on the local outbreak management plans. We have had £1 million worth of funding through from government to support this. So we're looking at where we need some additional capacity, or where we need funding to support some of this work. The expectation is that we'll need to have this in place for at least a year. So hopefully we'll need it for less than that, but we've got a plan for, as other speakers have said this evening, we've got to plan for this being in place for some time. So really resourcing this up so that it can take us right the way through into this year. So we're developing resourcing plans to make sure that we've got all the capacity in place that we need at the right points as well. So I'll stop there. I know from previous sessions there'll probably be lots of questions, but I'll take a pause there for any queries people have got.
Is it somebody going to think? Anybody want to ask a question? Councillor Kais, go ahead. Only got you at the moment. Can't see anybody. Sorry, Rosemary. Yes, Councillor Sexton. Councillor Kais first.
Thank you, Chair. Thank you for the very helpful report. The one thing that I wanted to get some assurance is there have been some suggestions that scammers are actually using the NHS test and trace services as a method of obtaining the personal or financial information from victims or vulnerable people. Does the local outbreak management plan includes any measures to inform people about this and to avoid such scams happening?
Yeah, so I think that has been picked up, and that there has been some communication which we've put out about, this is what the sort of message you'll get. It will only come through from this approved number. So that's something that has been communicated nationally. And again, we have been pushing that through locally. And I think one of the key things is the public absolutely need to have confidence in this system, and so we've got to make sure that it is safe and secure, and that people do feel confident sharing, because people are being asked to share phone numbers and contact details and things. So, really making sure that it's working well and the public are able to use it and trust the system.
Is it nobody else? Councillor Sexton, please. Thank you.
Thank you, Chair. I'm aware that I've had a lot of opportunities to ask questions about this with the Test and Trace Board, so I'll be fairly brief. The one thing I did want to query is, are we doing any work to find out what people's understanding is of what the current rules are, current advice, and what they should do if they're to get symptoms? From a few conversations that I've been having with people, there seems to be an awful lot of confusion around what the current rules are, partly because everything's changing so quickly. So I'm wondering if we've done any surveys or anything to try and understand what people understand by what we're telling them.
So we haven't done any particular surveys, but I think what we are doing quite a lot is responding to questions and queries coming in. So we've had quite a few from schools in particular, and head teachers saying there's confusion and people aren't quite sure what they need to do. So what we are doing is making sure that in that, so that particular situation, we will get communications out to schools, parents, or, we've also been doing similar things with care homes to just really reinforce that. So I think what we're trying to do is be responsive while we work out that there is a particular problem or people aren't quite sure what to do, that we pick up on that. But I think there was a big new national communications programme that launched last week, because I think one of the key things is people still don't quite know what to do if they've got symptoms, and where they go and how they do it. So we picked up on that, particularly with the learning disability issue, that there was a lack of, the information just wasn't out there in the way that people could follow easily. So I think we're picking up on that on the whole time. How do we make sure that people know exactly what to do and when? And the other thing we have put in place is a email and phone number, so that if people do have any specific queries, they can get in touch with us. We can provide that advice direct as well.
That's really helpful. I think if there was any opportunity to do some studies as to what people in general might be understanding at the moment and what they might not be understanding, that could potentially be useful. I don't know if that's realistic. In particular, in regard to some of the questions that I've had, there's one around the face masks becoming mandatory in shops. One thing that I've been asked is whether that also will apply to cinemas when they open, or whether cinemas for some reason aren't counted the same way as shops are. Again, this is partly an illustration of the sort of confusion that's out there at the moment, but also I wonder if maybe you can clarify that for me so I can pass that on.
Yeah, so I think, the guidance is changing all the time. I think we're averaging probably about 6 new pieces of guidance every day covering everything. So it is quite hard to keep up with it. And certainly, obviously, the face mask announcement only came in yesterday. So we're expecting a lot more to come through on that. And I think at the moment, we don't quite know whether that will grow. So is that going to just be defined to shops, or is that going to grow? So I think some of the, this is real kind of moving target stuff. And I think that's why that kind of constant proactive communications and pushing things out, we just have to accept that we're going to be doing that for months and months, because it will be changing all the time. And I think the other thing is, things like cinemas, obviously businesses will have slightly different ways of interpreting that. So, obviously there's a clear public position now on face masks in shops. Some businesses will choose to have higher levels of what they want to put in place than others. And we've already seen that there are some places that are putting in place incredibly high standards, and other people that are going along with with the minimum of the guidance.
Okay, that's helpful, thank you. Is there one single source that has all the guidance on in simple form that people can be directed to if they're unsure what the current guidance is? Is there a web page?
Yeah, so there's yes and no. So that there's a gov.uk website which we've got a button to on the council website. There isn't a single source of guidance, because I think there is now so much for every single sector and every single setting that it's almost impossible to have one very simple piece of guidance in place. But that website, it's updated all the time, and they do take down guidance and replace it and put on what the latest date of the guidance is. I think the difficulty we've got at the moment is everybody wants it to be very, very specific for their particular circumstance, and everybody will be in a slightly different circumstance. So, that all the way through people have been saying we want a really, really simple guidance, and actually that it's much more difficult to do than you think it is, because it's changing as the science evolves, and it's changing as more things open up as well. So we always put people's, the go-to point is that .gov.uk site, and obviously the communications material that's coming through that is a bit more specific to particular places like schools or workplaces.
Right. Thank you.
Councillor Thomas, please.
I didn't, for once, I didn't actually put my hand up to ask a question.
Oh, I thought...
I might have scratched my head or something. I did scratch my head at one point.
That's okay. Joe, I think, thought, not to worry. Right, colleagues, thank you very much indeed. Now, all items are important, and if papers that came through to us, you will see little two were the decisions that we are being asked to look at. So I've really got quite a longish list of the potential recommendations to put to you to recommend for council. So I hope you're happy if I just read it through, because it is a very important update that we've just had. And thanks very much indeed, Ruth, for giving us that. And also, I have to say the Tuesday evening chats and so on I know we've all found that very helpful. Right, so the potential recommendations are note the arrangements for testing and contact tracing within Solihull as a key part of management of the COVID-19 pandemic. We've done that. To note that Solihull is part of a national accelerated programme with Coventry and led by Warwickshire CC to rapidly test, learn and scale up localised approaches to prevention and control of COVID-19. Noted that Solihull MBC, in line with upper tier authorities, has developed and published a local outbreak management plan to oversee and drive multi-agency interventions to reduce the spread of COVID-19, including outbreak management and follow-up, the identification of actual or potential hotspots by time, place or person, and implementation of measures to minimise this risk. Noted that delivery of the local outbreak management plan will be implemented by a multi-agency COVID-19 Health Protection Board led by the Director of Public Health, and noted that the establishment of a shadow COVID-19 outbreak oversight board and CSW leaders group to provide local ownership and public-facing engagement and communication for outbreak responses to COVID-19 within Solihull and the CSW sub-region. So are you happy to agree with those recommendations, which we were asked to look at in the first instance? Yeah? Right, thank you very much indeed, and thank you, Director. Right, moving on, if we may, to item 8, the impact of COVID-19 on our Solihull care homes. And I do have to say that the impact of COVID-19 on care homes has been widely reported and is subject to considerable attention nationally. So tonight we're going to be considering a report on the experience in Solihull. It is right that the experience is given careful examination by this board. We will remember in our discussions that behind the facts given in the report are local families grieving the loss of their loved ones. For residents in our care homes, they have experienced the loss of friends and are living through the changes of the way of life this infection has been required of at each home. We will make sure that we remain sensitive to their needs for privacy and time to grieve, as well as for us to understand the learning that has been drawn so far. It's very important that we do remember those in particular who've lost people so close to them. So if we'd like to move on and have the report, please. Mrs. Murphy, you're going to come in and do this first, please?
I will do, thank you. And at some point I might call on Caroline Potter on matters relating to finance, Safina Mystery on our duty arrangements and PPE, and Helen Kelly from the CCG on our partnership working on this matter.
Thank you very
much. The paper sets out from the start the chronology of events and guidance. It was quite useful to reflect on how fast moving these things have been. But the paper starts by setting out when we knew what we did and what guidance we were following at what time, the practical steps taken to support care homes, our understanding of the impact of COVID locally, and the ways in which we are still working to understand and have further analysis so that we can prepare for a possible second outbreak and help to manage and support care homes through that. So I'll go through the headlines with you. In early 2020, members will be aware that we were starting to be aware of COVID from experience in other parts of the globe. And discussions amongst our care homes were already starting to be had about what impact this infection might have. A number of them introduced voluntarily various measures to restrict movement of visitors, to test their staff by checking their temperature when they arrived at work. And very quickly, in March, the full force of what was going to be felt became very clear, as the first directive by the government was issued on the 19th of March that was about enabling care homes to provide capacity so that those who were currently in hospital could be discharged when it was clinically safe to do so, and much needed hospital acute capacity could be available for those who were suffering from the anticipated effects of the COVID infection. This caused us to commission some additional capacity and to work with providers to help people leave hospital and move to care homes where it was appropriate to do so. With effect from the 23rd of March, care home providers were contacted by NHS England and Improvement, and they were required to complete an online capacity tracker that would tell the whole system about the vacancies that were available in care homes. We were urged at that time to make sure that practical arrangements for transport and for the delivery of any equipment to support people would be made rapidly available. And we were required then to look to 7-day working. So very quickly, our staff all had to consider how we could arrange ourselves, our working lives. At a time of lockdown, when we were all being dispersed to work from home, we needed to be available 7 days a week to support this national effort. With the arrival of lockdown, the pressure started to mount in care homes, and the challenges that ordinary things like the delivery of goods and supplies began to impact on personal protective equipment, PPE. Homes were reporting that it was getting increasingly difficult to source it. Their usual suppliers were simply unable to get it. And it was at that time that we started to organise with public health colleagues, with the CCG and partners, an arrangement locally to ensure that we could get hold of as much PPE as possible. And Safina in particular was involved in developing a duty system for that 7-day cover so that we could distribute PPE and ensure it reached those providers who were really struggling to get essential equipment. for safe care and protection of staff. As matters progressed on the 16th of April, the government then published the COVID-19 Action Plan for Adult Social Care, and this gave new structure with 4 broad areas: to control the spread of infection, to support the workforce, to support independence and people at the end of their lives, and make sure that social care services were available to respond to their individual needs, and to offer support to local authorities and providers of care. The action plan introduced testing for symptomatic residents in care homes. Care home providers had previously been concerned at the risks of accepting people from hospitals without testing, and this gave some reassurance there. Further moves that were made were to ensure that people isolated when they moved into care homes initially. It's quite a difficult thing if you're moving into a new environment, but it was absolutely vital to contain the virus and make sure that any risk of infection was protected within the room of an individual. But it was a very difficult experience for them and for their carers. We were also urged to cohort or group together people in settings so that those who were already affected by COVID were looked after by people in a restricted environment and kept separate from those who were not affected by the virus at that time. We were urged to restrict care workers' movement between the community and care homes, and in particular to avoid, where possible, the practice of care homes moving between care homes, carrying out shifts in different care homes, but bringing with that the risk that they might carry the infection with them. The improved testing did mean that we were able to get access to testing of workers through the facility at the Edgbaston Cricket Ground, and that was later supplemented by testing that was coordinated by CQC. There were pressures in care homes because of the impact of the virus on the care workforce. As they fell ill or were required to self-isolate because of being connected with someone who was ill, there were real pressures in care homes. We did use funding that was made available for COVID to try to offset the costs where care homes were required to source additional staff, potentially through agency or temporary workers at enhanced rates than would normally have been the case. But the aim was to maintain the usual standards of care. I'm sorry, my laptop has just decided to log me out of the network at that point. Can I just juggle around with my iPad and see what I can do? What great timing. Right, from memory. I'm going to have to do this from memory unless I can log on simultaneously. What else were we doing? Chair, could I ask for a pause and then my laptop can be logged on to the network? It's just booted me out of the system, so I need to reconnect. Would that be possible? Give me a couple of minutes to do that.
Okay, 2-3 minutes, everything off.
Thank you, that's a great help.
Okay. Sorry, Karen.
I'm on the case. It's because I think I logged on at about 7:30. It thinks I should have had enough by now.
Are you ready? No.
Not quite, not quite.
Right.
Just about to put another passcode in. Almost. Sorry about that. I'm back.
You're back. Go on then.
I'm back. Yes. Right. Where were we? I think we just got to the point where things were getting very hard for the workforce, and they were starting to recruit temporary workers, but that carried with them the risk of the transmission of infection. We also put in place some practical support. Regular calls were being made to care homes to enable them to offload some of the stresses of dealing with COVID. Some exceptional efforts had been made by care workers who had moved into a couple of our care homes. They had left their families and moved in for several weeks at a time to try to reduce the risk of infection. Many of them were working very long hours to try to provide comfort to older people who were really struggling. They were isolated from their families. The contact they did have with families was through telephones or the use of things like iPads, for instance. But you can imagine that for those older people who may already have been struggling with the effects of dementia and frailty, were being cared for by people whose faces were covered, the familiarity of their friends, their family, and the visits were no longer available to them. So the care workforce were taking a lot of the strain of that upon themselves. By the 14th of May, the progression of the scale of outbreaks in care homes was acknowledged by a letter from the Minister of State addressed to local authority chief executives. By that time, around a third of care homes nationally had had an outbreak of COVID-19. And the letter set out arrangements for a locally led system to support care homes under national oversight. A new infection control fund was created, setting aside £600 million that was to be used to provide explicit support to providers to introduce better infection control methods. And this drew on the available research that had been building during the period of the infection globally. Local authorities were asked to lead on putting in place a care home support plan. And we were very fortunate in Solihull in that we had by that time established some excellent working relationships. We believe we always work well across the health and social care system. But I think the way that we were able to call on partners to help to put in place the arrangement to support care homes meant that we could produce a plan quite quickly that demonstrated the availability of services to build resilience, to support the workforce, and to support those providing care for the most vulnerable. So the plan was submitted at the end of May, and along with the details of what would be available locally, and the support that we would distribute through the infection control funds was set out also. The first distribution of funds had been made, and Caroline has been analysing how that's been used so far, and we're distributing the final 25% of the sum of money we were given in Solihull, and await the distribution of the next tranche of funds that we can use to support the providers. So further methods that we used to try to mitigate the impact of COVID. Care homes, as I said, had stopped visiting early on. This has gone on for months now. You can imagine how distressing this has been. There have been mentions in the press over the last week or two that there may be an announcement that this would be lifted, but we haven't heard anything yet unless something was announced while we've been in this meeting. At this point, restrictions on visiting are still in place. The only contact that residents have been in exceptional circumstances at end of life. There may have been visits to some people. But sadly, for many of those people who are at the end of life, those who would visit them are also in the high risk groups, and some have chosen not to take advantage of the opportunity for visits because of the extreme risk that they might expose themselves to if it was to a home that has active COVID infection. There have been some visits made possible outside in the better weather. People have been able to have socially distanced visits in gardens, and they were welcomed and appreciated, but not always appropriate, and certainly not a substitute for regular contact in the privacy of one's own room in the care home. We've maintained contact with the care homes, as we said earlier on. We continue to have daily contact with many of our homes. We are required under the ministerial letter to have a daily statement of the status of each home. So we have careful systems in place, working collaboratively with our partners in University Hospital Trust, the CCG, with Public Health in the Council and Public Health England, to know what's going on in those homes, about any new outbreaks, any needs for support, any difficulties in accessing PPE or needing training. And more recently, we've also been able to talk to them about the financial impact of the COVID infection on homes. As officers, as I mentioned earlier, we've conducted a duty system originally from 8 till 8 during the peak of the crisis, which meant that responses were to care homes at the time at which they needed them. We've eased that slightly now and reduced those hours as it became clear that it was no longer needed. But I think one of the things that we've learned is that for some of the care homes that we wouldn't have a contractual relationship with, they've learned that we are as a council available to provide support to all. If the home provides support only for people who self-fund, they're as eligible to have a listening ear and practical support and guidance and access to training as any other home. And we've been very pleased to build those connections with them. We've also used some of our local services. Health Watch have been keeping a watching brief and listening to any comments made. And SATA, I mentioned in the report in paragraph 319, produced guidance early on in response to some national concern being expressed about the use of do not attempt resuscitation and advanced care planning directives. There have been no reports of adverse practice in Solihull, but we felt that it was very helpful to have guidance for care home managers and staff, and for families, the reassurance about how that sensitive matter was being approached and handled. One of the things that we did in Solihull that was quite unique nationally was to set up a care workers fund for those experiencing hardship as a result of COVID. For some workers who were on either very minimal hours contracts and lost all of their income when they were self-isolating, or suffered a loss of income because they were in receipt only of statutory sick pay, they were facing extreme hardship. And so a significant sum has been made available to them to access through a national charity, the Care Workers Charity, and that helps them to face loss of income, but also some of them have faced the unexpected cost of funerals for relatives. And the charity has been in the press this week as having been successful in generating significant funds for others nationally as well. We made arrangements for some employee assistance program support for those experiencing practical and emotional difficulties for those homes that were registered charities and otherwise wouldn't obtain that kind of help for their staff. Practically also, we've delivered provider bulletins. I say 22, I think we might be up to 24 now. As we mentioned, Ruth said that there's been a lot of guidance. There has been an increasing volume issued several times a week, and what we've tried to do is collate that for providers to edit some of the key highlights, to present it in the simplest form, and to give a local interpretation to make it as accessible as possible and issue that to all the providers. That's been quite well received. I think people find it useful to be pointed to the most recent version of things when they've been absolutely overwhelmed with guidance. It's well intentioned and it's really detailed and some excellent stuff issued, but it can be overwhelming when you're also trying to provide care. So from the care home experience for the care workers themselves, it has been a time when they've had more exposure and more attention in the media than ever before. I think that more people have expressed views on how valuable care workers are to the community and how their role has been invisible previously, but we're now starting to see just how vital they've been. They are relatively low paid workers, but they have faced the threat of virus themselves. They've supported the most vulnerable in our community through what are now months of isolation. They've supported them through testing, through periods of sickness, and they've supported them through end-of-life care. They have made all manner of efforts to ensure that the isolation from family has been not a sense of them being in the room by themselves with nobody, but have provided who operate part of the community services run by University Hospitals Birmingham. That team has offered clinical support to all of the homes in the borough, has been physically the face that most of our care workers and managers have seen on site, have been there providing the clinical advice, the interpretation of guidance on the use of PPE, demonstrating, showing, supporting, doing the swabbing, providing moral support for managers. I think they have been absolutely extraordinary. There've been others, there've been many others too in the care homes, but I think that particular team deserves to be singled out for praise. And I should say that we've been in contact with a number of care home providers who run large chains, and they've pointed out that they don't know of an area that has a service like that, and they've really valued it enormously. So the extent of the virus on Solihull's care homes. Data has been enormously difficult to collect. I felt reassured that I'm in good company with the Office for National Statistics, that they've also found it challenging. The data for infection, outbreaks, testing, delivery of PPE, because of the mass national effort, throwing as many sources of support as possible, it has meant that some of our data has not been as consistently available as possible. And nationally, there is a concerted effort to interpret, to clean that all up and make sure that we have the best possible learning from COVID to understand what the impact has been and what we can do better. For that reason, I've only included validated and absolutely reliable statistics in this paper from sources that we can have confidence in. So for that reason, I can give you in the table 1, which shows the rate of infection experienced in Solihull's care homes at 3.31, and you'll see that the peak of outbreaks was mounting from late March right the way through to a peak in late April, and then tailed off significantly afterwards. We have 60 homes in the borough, and they're split evenly between those for older people and younger adults, but the incidence of coronavirus has been very heavily weighted towards those for older people. There have been small outbreaks in facilities for learning disability, but the scale of outbreak has been significantly affecting more those homes for older people. The number of deaths for care homes has been quite a difficult one to capture nationally, and if you care to look at some of the detail of why that's difficult, it's captured in the ONS report included in the appendices. There are different methods of recording death and different sources. I'm sorry to say that there have been, we believe, 66 deaths directly attributable to COVID in Solihull's care homes. And there is further work being carried out to understand the cause of death for other people reported. But members will be aware that the symptoms of coronavirus have been developing. Our understanding of what the classical symptoms are have been developing during the pandemic. And it is possible that when we look back at some of the presentation that is atypical, that we may see something different in due course. So at this point, that is as much as I would want to stay on data until we have really got a full understanding of it, and we'll be happy to return with more detail if members want that in due course. The financial impact of COVID has, of course, been felt on the care homes themselves. The cost of agency workers of paying for staff sickness, of paying inflated prices for PPE and for other medical equipment, for food supplies, has taken its toll on some of the care homes, and not just small local ones. Some of the larger chains have been reporting the significant impact felt. So even with the clout of their purchasing power, they have really felt the impact of COVID. The government has supplied funding to local authorities to offset some of the impact, and that has already been distributed, both in a lump sum earlier this year and then subsequently through the infection control funding that was distributed in early June. There are conditions attached to some of that funding, and we are to be held to account as a local authority to government to demonstrate that it has been used in accordance with those conditions. And Caroline can say more about how we're monitoring and making use of that funding to reach our providers. If you've heard that it isn't reaching providers in some parts of the country, some of the provider groups have said it's not been entirely smooth. I can assure members that it has been reaching providers in Solihull and is being spent. We are concerned, though, that where some homes have had impact of infection, where they've sadly lost a number of residents and have not been able to readmit new residents to those places, the impact of having so many vacancies is causing some significant financial strain on those organisations. We're working very closely with them, having regular conversations about where they might be eligible for additional support from the council to maintain them. Our concern is to maintain the homes for those people who remain in them and to start to rebuild confidence in care homes as safe places to receive care for those who truly need it. At this stage, as the society as a whole emerges from lockdown and we're freed from some of the constraints, it's absolutely vital that we maintain the attention on social distancing, infection control methods and rigorous use of PPE. We are concerned to make sure that the homes are cleaned appropriately, that social distancing is maintained, and that the relaxation of the messages about how we operate in life outside care settings, when we're in a care setting, absolute rigour needs to be maintained. And so some of the testing arrangements that Ruth described a moment ago will certainly apply to those care workers who are in contact with others who may be affected. We can't afford to loosen our guard at this point. We continue to have daily monitoring discussions at 8 every day to discuss the status of the homes. We monitor the impact on staffing, on care quality, and on the financial resilience of our care homes. And we'll continue to do so until we emerge from the full impact of the virus. I don't think there's any more I need to say at this point, but I'm happy to take questions and to share with colleagues who might also have answers to help, Chair.
Councillor Hall-Allen, you weren't on loudspeaker.
I should be. Can you hear me? Well, I didn't touch it. I was on it. Still there. Right. Okay. Well, Karen, thank you very much indeed. That was very in-depth, as is the report itself. And I'm sure members have ploughed through it and taken in a lot of what you've said. And your sensitive approach to the facts and figures is a bit more difficult. Do I have any speakers to questions I've got? Yes, Miss Katie, Blunt, Thomas. Can't see everybody. Kais. Go to the next lot. Right, Katie, do you want to carry on?
Thank you very much. It's not a question, it's more of a sort of a comment, really. I just want to thank all the officers for their hard work during this. Obviously, privately, we've had our own communications, and you've answered all the questions that I've had really well and really detailed. And when I've asked for assistance, I had an almost instant response. And, you know, it really is very reassuring because unfortunately what's happened has just been dreadful, but the response of officers during this time has really been genuinely exceptional. And I think this department especially, and the people who've been working on this, really do need to be thanked publicly for their response to this, because I know how hard you've all been working. You've been answering emails at ridiculous o'clock at night when I've been sending them, and I'm sure other councillors will have had that experience too. So, you know, I really just wanted to say thank you. And, you know, obviously there are sort of more private reasons why, you know, that you've responded to questions. And, you know, I really do think the report is very detailed, and the work that's just gone on behind the scenes has been genuinely exceptional. So I really just wanted to say thank you. But all of my questions have already been answered in private minutes. So thank you ever so much.
Thank you. Councillor Kais, please.
Thank you, Chair. I just want to echo what Councillor Blunt was saying about the remarkable work the officers have done, and the weekly briefing, all the hard work that has gone and are still happening. Also, I would like to pay tribute to the care workers, especially on paragraph 3.26, to the extent that they have gone above and beyond their roles and responsibilities, and the way they have responded to this very unprecedented crisis. So I just wanted to thank all of those care workers as well. Thank you, Chair.
Councillor Sexton, please.
Thank you, Chair. So I'd very much like to echo the comments so far, Councillor Blunt and Councillor Caius. As I said, this report in itself is a huge piece of work, and I'm aware that there's far more that's gone on behind the scenes. So thank you to all of our social care officers for everything they've done there. I am going to ask a couple of questions. I have had most of my concerns addressed over the course of the last few months, but there's a couple of specifics I want to pull out. The infection control funds that have been distributed, there are some particular things that we were hoping to achieve with those. For example, minimising the need for care homes to use agency staff who are working across multiple care homes, which obviously carried an increased risk. Do we have any evidence yet as to whether that has been successful in achieving any of those aims?
If I may, I'll ask Caroline Potter, who's been in direct conversation with providers, and she'll be able to give you details of that.
Thank you.
Thank you, Karen. The returns that we've had from providers, they had to submit how they were using the funding to us on the 19th of June. They'd only had it for a few weeks at that point, so you'll have to bear with it that this is sort of early data. But a lot of the providers have been using the funding to aid their recruitment, to make sure that they could retain staff and to cohort their staff to individual groups of residents. So even where they were using agency staff, those agency staff weren't being used across multiple sites and were not circulating fully around the home. So our indication is that yes, they have been aiming to do that.
That's great to hear. It's good to hear that's been successful. That brings me on to my next point, which was around the recruitment. And I know that there was a national recruitment campaign. It's mentioned in 3.11. What has the response been to that, and how successful has that been?
I think it's early days. I think anybody would recognise that with some of the press reports that we've been seeing about the care sector, it's not the most attractive proposition at this point. We're very hopeful that once the worst is over, that the positive press that's been given to care workers and the real attention that's been given to social care will start to appeal to people. I think there's been a level of awareness about care homes, what they do and who they're for, and the exceptional work they do in ordinary circumstances, never mind when they're facing a pandemic. We're very hopeful that it will appeal. We're in close contact with council officers who are working with people who may not be able to return to work in the hospitality sector, or people in other sectors who may have skills that are, now they've been made aware of social care, might want to change direction. So we're already working to support people who may be either losing their jobs or are looking for a change of direction, and trying to link them with jobs in the care sector.
That's great, thank you. In one of the sections at the end where it's talking through some of the support measures, it mentions that where social work teams have replaced face-to-face contact with digital or telephone contact with people. I'm wondering, in situations where people may have had communication difficulties or sensory challenges, what has been done to ensure that this change in manner of communication hasn't unduly affected those people?
A couple of things I think have been done. I mean, we've been pleased to see some special guidance issued nationally that was for people who have learning disability and autism. easy read material has been made available on the use of PPE. Why do my care workers suddenly start to dress in these strange things and look the way they do? Why am I restricted in what I can do? We've been able to clarify that for people with autism who are particularly badly affected by disruption to routine, that the limitations of lockdown were being quite literally interpreted, and we were able to advise some of the providers that there were things that they could do legitimately if they operated safely. I do think it's been quite challenging for those people who've got any kind of cognitive impairment to explain the limitations on their movement, about what the risks are, and my admiration to staff who have been trying to explain and work with PPE to explain social distancing and safe methods of infection control. It's been incredibly difficult, but we have been helped by some useful material, and we are of course making sure that the support that goes to care homes, although as I said the major impact has been on older people's provision, we're reaching out and having exactly the same conversations, the same offers of support to those smaller homes with people with learning disability or mental health needs.
That's great. With regard to visiting in care homes, I'm aware that this is still challenging, obviously, with the ongoing situation. I'm wondering what the thinking is around how we go forward. If COVID is going to be with us into next year and potentially beyond, then what that future is going to look like, and whether that might be looking particularly bleak for people who are isolated from their family for potentially an indefinite period going forwards. So I'm wondering where the thinking's at around that, and whether anything is being done to work towards a longer term solution to that problem.
We are following national guidance on this, and will continue to do so. I would imagine that the mutterings at the limitations on visiting could be lifted mean that there is some significant work being done behind the scenes. I think some of our care homes have tried to be creative whilst observing tight infection control measures. They've been talking about having gazebos or building some kind of summer house in the garden. They've used rooms that have separate entrances for visitors to use, and they've really tried very hard to say not all families have coped well with this, and not all residents have coped well with the limitation. It's been really tough, but they have tried to say, look, if it is about end of life care, they will find a way to have visits where it is strictly needed. But other than that, it's just incredibly difficult to observe the right infection control methods, to observe social distancing, to make sure that your PPE is used appropriately by people who are trained in use of it, and don't inadvertently bring infection into a home that might otherwise have been infection free. It's very tough, and I do agree that in the longer term, I really hope we'll get fresh national guidance that will allow it to be managed in a way that's safe.
That's great. Yes, I mean, I appreciate this is a heartbreaking situation, and without any easy answers. Finally, I want to end on a positive note. I'm really, really pleased to see the hardship fund that's been set up. I mean, as some of the officers here are well aware, I've been raising concerns around the lack of full sick pay for care workers since March, and this was something that I was really concerned about as a potential public health risk. So it's great to see that I found, again, not a perfect solution, but actually something that's going to help an awful lot of people, and is going to provide a valuable safety net. So I'm really pleased to see that.
Right, thank you very much indeed. I've got Councillor Howell. Was there somebody else who indicated earlier on? Councillor Thomas. Okay, Councillor Howell next, please, and then Councillor Thomas.
Thank you, Chair. Yeah, thank you, Karen, for your really, really detailed report. And I'd just like to echo what the other councillors. I think you and your fellow officers and all the care home staff, it's been an incredibly distressing time and an incredibly fast-paced, fast-moving, unpredictable situation. So again, we extend our thanks for work that you do. We're not through this situation yet. We don't know how long will be with us, but obviously you've obviously had to react and make some very, very quick decisions to stay on top of these very, very difficult conditions. Will you be any sort of period of reflection really, so that you can work through all the issues that you've had to tackle? I mean, you've tackled sort of 10 or 20 years worth of issues, I'm sure, in just 3 months. Will you be having any sort of period of reflection to work through that, to identify perhaps any lessons that have been learned and any learning that you could implement in the future should this pandemic continue?
That's a very timely question, thank you. Yes, I mean, the learning's been happening daily, really. We've learnt new things, we've implemented new things, we've applied the learning as we've been going through. But I do think we are at a point now where there is a slight lull. The worst of the infection is over, and we are looking at the data that we've got. We have a group, a multi-agency group, with the CCG and GHB, with a GP representative, and we meet weekly, and that will be the focus for where we review the impact on care homes of COVID. We are anticipating that we need to do something quickly. We need to have the learning applied and ready should there be a second spike in infection. So we're looking to have at least some decent level of analysis and understanding done over the summer, ready to apply from September onwards.
Thank you.
That's it.
One more question, if I may,
Councillor
Chair.
Thomas.
Oh, Chair.
Yeah, go on.
Can I just have one more question, please? Thank you.
Yeah.
Really good to hear that you are acknowledging that some of our care homes have financial pressure, and good to hear that you're signposted them to areas of support for that. But do you have any contingency plans should we be looking at a worst case scenario where some are looking at closing their doors?
We're very much determined to try to avoid that happening, and that's why Caroline's been in close discussions with them about what support they need to avoid that happening. We've encouraged businesses to take advantage of the generic business support that's been made available through the government right the way through the pandemic, and where there are some more tailored things available through the funds that have been made available for social care, the infection control fund, and some of the more practical things about how we can help them to get staff in so that they can reopen and manage their infection so that they can start to readmit people. We will do everything we can. We do have protocols in place should a provider fail for whatever reason, but our aim is to provide support and be as accessible and available as possible to the proprietors of homes so that we can understand what their pressures are and tailor a response to them.
Councillor Thomas, please.
So I think to a large extent, I'm going to echo probably a lot of the comments, although I'm possibly going to make myself a little bit unpopular with my first statement in terms of I think we actually on care homes probably saw two very different sides of the story. The national side where things were delayed, there was a lack of guidance and things happened far too late. And the local side, which on the flip side appears to have been very proactive, probably ahead of the national guidance at times. And again, to echo the point that I think almost everybody else has made, just how well done our local officers, our care home staff have done during this period. In terms of questions, I think Rosie actually asked a lot of my questions, which were around staff and recruitment and the shortfalls in staffing. But I suppose my only outstanding question on that is how many vacancies are there currently for care home staff in the Solihull region?
The short answer is I can't tell you a simple answer to that. One of the challenges we've got is that because some of the homes are so down on numbers, they don't need as many staff as they would normally. So it's very much a moving feast. As they can get more people in, they'll need more staff. Some of our homes, we've had 2 homes that are brand new just before COVID, so they got a lot of vacancies, but they aren't yet in a position to recruit or to admit people to those homes. So to give a hard number of vacancies is really impossible. I'm sorry.
Thank you.
Councillor Mackenzie.
Thank you, Chair. My mother's in a local care home, so it was a real worry to me the whole scenario about COVID for all the families that have lost elderly parents. But at 6.2, you're saying you haven't had time to engage with people that have used their facilities, the care homes. I'd just like to be on a positive note with you that care home my mother is in, a local one, has had all the PPE. They've told me, they reassured me. They've had testing done on staff, on residents, and they've really reassured me totally about her care. Obviously, I wasn't able to see her for a long time, but they then have facilitated me and other, I suppose, relatives, only one person at a time though, to go into the garden when the weather was nice, only very, very recently, to sit distance apart and no touching. And we had our temperatures taken, we had to fill in a form questionnaire. So they are really trying their best. And it's really, really hard for the staff, for the residents, but mine has been a really positive experience. So I can just say thank you to the care home, and I just hope that with the winter coming on, that things are not going to get bad again. So that's all. Thank you.
Don't think I've got any more questions, Karen. One or two that I was going to ask, but it's just about all been said. I'm conscious that this is going out live, and I think the one big thing that worries people, and I think it's 3.6 where you discussed how things were in the early stages of this pandemic, and members have mentioned it. But I think people want to have the assurance, and I hope we've got that, and I think Connect's just been discussing it, that should these problems rise again, I know people are very anxious, and I certainly don't want it to happen, that we have got the provision that I think we need, and I believe we have, of PPE in particular, which I think maybe a lot of people felt we didn't get quick enough in some areas, in other areas we did. But I think that's the sort of assurance people want to know. And can I just go back on 310 in your report, you talk about workers moving between the community. I was a bit, what do you mean by that? You mean the people that actually go into the homes and then they come out again and then they get on with their lives? Is that what you're talking about? And the risk that they may have of bringing it in and out? Because as I understood it, certainly at the early stages anyway, a lot of carers in the home stayed there. They didn't come out and walk about. Have I got that wrong, or am I going by the media? Or
no, that was true for a couple of homes in Solihull. They did maintain a staff group who lived in for a number of weeks, but many other carers weren't able to do that. Right. And so they were travelling from home between their family, using public transport often, and mingling with the community as normal, and then going into work in the home. So there were some risks associated with that. The Infection Control Fund has encouraged the use of taxis, electric bikes that we're looking at, anything that minimises exposure to infection risk on public transport. And if necessary, one of the things that was being discussed at one stage in the peak was to provide alternative accommodation. So if a worker couldn't safely be back at home, maybe there was somebody at home who was suffering from symptoms of coronavirus, that maybe we would need to put them up in hotels until it was safe for them to go back and they could continue to work. So the funding's been made available to come up with creative solutions to mitigate those risks of transmission from the community into the care homes.
Yes, I think that's an issue we're concerned about. So hopefully, if we do need more help, and maybe we will have a spike, then we have got the equipment to fight it as and when it comes on. Should it come on, I should say. You feel we've got the PPE. I think we're getting that through from the chief exec anyway, aren't we? So hopefully everything's reasonably safe. I mean, it is a worry. It is a concern for everyone. Colleagues, thank you very much indeed. You have asked probably the obvious questions and a little bit more. The media does tend to dominate these days, but the report is excellent for what we're capable of, what we're doing in this borough. I mean, it's a good thing that people are living longer and better, but the problem is taking care of them so they do living even longer and longer. So that's what we have to look at. Colleagues, thank you for what you've put into this as well. We are being asked as a board, if you look at the beginning of the papers, to recognise the challenging circumstances that care home staff have worked in during the COVID-19 crisis and thank them for the contribution. Well, thank you, colleagues. Several of you have mentioned that, and I would endorse what you've just said as well. They have done a marvellous job and continue to do so. We've been asked to note the findings of the report and request that the report will be provided when full analysis of the data was available to understand more fully the outbreaks of infection in care homes in Solihull and to learn from the experiences of residents and families. Does the board agree with those recommendations, or is there anything else you would wish me to add? You okay with that? So Karen, thank you very much indeed. That was a marathon for you, not least getting technical services have been going away for a few minutes. And certainly at one point we had the most incredible noise coming down the line. But there we are, this is what happens in these days. But colleagues, thank you so much for your input as well. And then we'll just move on. I think we've got one more item, haven't we, to look at our the actual programme for next year. So we could move on to that, please, members. Joe, do you want to introduce the programme?
I've just members, just for information, I've included the work programme that that was presented to the last meeting as well, with the changes that had been requested.
Thank you. Any comments on that, colleagues? As chair, I have always tried to have 3 items per meeting. Actually, we're a bit sooner tonight than we have been in the last 2 or 3 meetings, but we, you know, they are very important. Every item we seem to get is very important and very much in depth, put together by our officers. So we do thank them for the work continually that they're continuing to do. And also, Cabinet Member, thank you for being here and always attending. And I just keep our fingers crossed that we don't have any more flare-ups and we can just keep to the programme we've got. So I think that is it. Joe, have I missed anything? No, we're going to continue, I think, next Tuesday night. Is that right? For a phone in? Yes, 20 something, I think it is. Tuesday, anyway. So yep. We'll do that. That's been helpful. I agree with members. I'm sorry I missed the last one, but they're very helpful. So that's really lovely. So I think that's great. It's about not quite the hour, not quite 9 o'clock, but thank you all very much indeed. And I think I'll close the meeting unless anybody. No, you're happy for that? Joe, thank you so much, Joseph, and everybody. And everybody look after themselves till the next time, which is September. Okay. Bye.
Thank you.
Bye. Bye.